we've been working on in government is really about how we get people access to the healthcare system. So if you think about the talks today, they haven't been about insurance, they haven't been about billing for services, although a little bit of Allison's might have been. And it's important to remember, and I always have to remind myself as a government official, that so much, the vast majority of what determines health, actually doesn't have to do with health insurance and hospitals and doctors. It has to do with what we eat and how we live and where we live, our education level, actually surprisingly well correlated with health. And so it's about healthy water, healthy air, but we also need to make sure, and this is something that government is very involved in, that when you do need health, or when we want you to be engaged in our healthcare system to help you stay healthy, and heaven forbid you're very sick and need intensive care, we want to make sure you have access to those services. And in our country, we have an insurance structure in place, if you're working age mostly. We have a publicly financed insurance structure in Medicare for people who are over 65 or disabled. And for low-income individuals, we have our Medicaid program in Rhode Island, which is Right Care. So we have kind of a complicated hodgepodge, and no surprise that in that complicated hodgepodge, there were lots of people who were left out. And in our country, there were somewhere between 45 and 50 million people who didn't have an insurance card. So when they needed care, they often were forced into the place that was probably least appropriate most of the time, which is a hospital emergency room, or hopefully they had a good neighborhood health center in their community, and we have many of them here. So the law that passed a few years ago, you may have noticed it, even our younger students here may have noticed it, because boy has it continued to cause an amazing outcry in our country. I was very pleased actually when our president decided to turn the pejorative term Obamacare and embrace it and say, you know what, when it's successful, it's going to have my name on it. And we're starting to see that turnaround, and I'm going to talk a little bit about what we've done in Rhode Island and how we have used that law. So it is a law that is largely focused on getting those insurance cards to as many people as possible. And the way that you do that, the portal for people in Rhode Island is called Healthsource Rhode Island. It has the very unglamorous term in the federal law of being called a health insurance exchange. And what it really is a website to go on and purchase health insurance. Now, there are lots of other good things about this website. One of the biggest ones is that most of those people who didn't have insurance didn't have it because it was unaffordable to them. And our federal government has created a subsidy structure that's done through in a very complicated, you really want to have your eyes glazed over way, but the reality is it reduces the premium cost for people who are lower income, and then that subsidy declines as your income goes up until you're 400% of poverty. It also means, when you go onto that website, that you may discover, as about 30,000 people in Rhode Island did who are already eligible, and an equivalent, probably 40,000, a little bit more, who are newly eligible, that you may be eligible for our Right Care program, for our Medicaid program. So you can get care in a doctor's office. You can get services you need without having to be put in the very worst position, which is needing to pay out of pocket, damaging your credit rating if you can't afford the bills, which most of us can't. Even those of us who make plenty of money, paying a hospital bill right now is pretty overwhelming if you've seen one, even a doctor's bill. So we created Healthsource Rhode Island. It is a marketplace, it is a website, and you go on, and then you have that mind-numbing experience of trying to figure out what the heck you want to buy. So we have people who will chat with you, we have people who will talk to you on the phone, and actually what we discovered lots of people did is they put all their stuff together and they walked into the office for Healthsource Rhode Island and said, I need some help. We have other people in our health centers, whether you live where Thunder Mist is or the Providence Community Health Centers, East Bay, they're all around the state. They had people called navigators to help you navigate that complicated world. We have enrolled about 80,000 people in Rhode Island who didn't have insurance. One of the biggest categories were people who were newly eligible, who were adults without kids at home, who couldn't afford insurance and were very low income. And they're in what's called Medicaid expansion. Some states, that was a big national issue. It continues to be one. Some states have chosen to do it. Some states have not. And the Supreme Court, when they said the law was legal, upheld the law a few years ago, they did say that the law could not require states to expand Medicaid. So you will continue to see, and I gave a talk this week on a college campus and said, go back to your Federalist Papers in the beginning of our country, where it talks about what we give to the states to manage and what we give to the federal government to manage. And we have over time had times when the federal government took authority from the states, and this law does some of that. But the states are allowed to make their own decisions about expanding coverage for low-income people. I am proud we have done it in Rhode Island. And you go in that one-stop shop, and it will send you down that path without you having to figure out yourself whether you're eligible. But I will say as a campaigner, I would frequently meet people 57 years old, not old enough for Medicare yet, not disabled enough yet. You want to hope they wouldn't be disabled, but not disabled to qualify for federal Medicare before they're 65. Waiting and just saying to me as a politician at their door, can you help me? Can you help me find a way to get the medical care I need? I don't have enough money to pay for it myself. Now we have a way to help them. And many tens of thousands of Rhode Islanders have become eligible. That's going to mean that they will get the services. I mentioned oral health earlier. Many of us are unaware how many people can't see a dentist. And I was hearing a story yesterday of somebody who removed their own tooth when they had an abscess. People who don't get the mental health services that they need because they don't have coverage. People who end up in an emergency room with a manageable chronic condition because they can't get into a doctor's office. So insurance plays an important part, but it is not the only part. We also need to think about health. And that's where conversations like this can really help. And the federal law, kind of below the radar screen and outside of all the noise and yelling and screaming about Obamacare, because you see it very visible in red states and blue states, the federal government said to states, we at Medicare are really thinking about creative, better ways to provide and pay for services for older Americans. And being married to a baby boomer, and an early baby boomer, and a later baby boomer myself, we as taxpayers are going to have a heck of a problem already paying for health care with a booming older population. And so they're thinking about creative ways of providing care and thinking about outcome, not just how many services are being provided. Are we making patients healthier? And how do we do that? So we've got some amazing innovations going on. Anybody here a patient at Coastal Medical? Okay, Coastal Medical is what's called an accountable care organization, a federal innovation. They've got a great partnership with Medicare and with Blue Cross and United Healthcare. That's where they get paid extra to manage people's care appropriately. And if they keep people out of the hospital in the right way, not because they deny them care, but because they keep them healthier, they actually share in the savings. It's a way of changing how we do what we do. You're going to hear about Care New England doing something similar with their hospitals and physician practices in the community, getting people into primary care doctors and getting their services, supports that they need. And then, think about it. If you're in a doctor's office and your doctor goes, you know what, I'm trying, but I can't manage some of the things like housing, like the work environment, like need for food and SNAP benefits. And you start building a network focused on health across the broader community. It means that we do more about health in our schools. We do more about not wagging our finger at people about how they live, but creating an environment and a community focused on improved health. When we saw that map of America and obesity, and there was a conversation that was about how we are less active, how we sit all day. We can have a similar conversation that feeds into that, Martin's words before, but about what we eat, about how we live and what we eat. I am a great believer that we need as a community to be having those conversations and not wagging our finger at people, but reminding them. One of my favorite things in the Obamacare law is now when I walk in a hurry, and I do, to a place where I can get food that maybe has not been cooked to order. We all do that sometimes, don't we? They list the calories for me, and I actually make different decisions. I buy something different because the calories are lower in something that will still satisfy me for lunch in a hurry. There are things like that that can help us take control of our own health. And that is what Obamacare is about to me. And for any of you who don't have health insurance, go on Healthsource Rhode Island. Open enrollment for individuals is only for 8 weeks a year, and it will start in the fall. And if you have a small business, there's some real opportunities for a group that has a really tough time getting affordable insurance. So be proud that you live in a state that has taken full advantage of this law, and help us build a healthier, stronger community. Thank you.